I'm Dr. Frank Noyes, and this is the Arthrofibrosis Center, and we're speaking to you from Cincinnati, Ohio, and I'd like to introduce Paula.
Yes.
And Paula, you've had a problem with your knee, and you have diagnosis of arthrofibrosis, and you're from Fort Lauderdale, and you had the surgery about 10 months ago.
Yes.
Your first total knee.
Yes.
And you were telling me, what was it like after your surgery? You did get into a problem with scar tissue. Can you describe that for us?
Well, it was very painful, and I lacked range of motion, and I was stuck at bending at 70 degrees, which was very debilitating
Yeah, and so
painful.
and you probably had multiple different explanations for it or opinions.
Absolutely. A lot of confusing and contradicting opinions.
And we were saying before, people don't realize how devastating arthrofibrosis is.
It's very debilitating. At 70 degrees, I couldn't go up steps or get into a car or sit correctly, so it was debilitating.
Right. And so when we saw you, we had a long talk, didn't we? Long talk.
We sure did.
Okay. But so far it's worked out, and you've had surgery.
Yes.
And so we get to brag a little bit about you. Can we do that? She's been an excellent patient. And
I followed the rules.
that's right.
Yes.
You did follow. And how is it to be in Cincinnati for 4 weeks?
Well, Cincinnati's lovely. Everybody is very helpful here, and of course, I've found, the answer to my prayer. So it's been absolutely wonderful. I mean, heaven sent, really.
Oh, you're so nice to say
So
that.
I mean it.
Okay. And so her kneecap is now moving
Oh yeah, it was stuck before.
before it's stuck. And so we're now only 4 weeks out.
Yes.
And you want to show off a little bit. And we did
Oh.
get past 70.
Yes.
And keep going.
Yeah.
And keep going and keep going. And what did we get today? We were 115?
Yeah. Well, I've been measuring at 117
Oh,
from
that's
70.
great. And so before you were at about 70. And so we are, and I don't want to push you because
No, I'm good.
we still have work to do. And after surgery, we did actually get you back to 140 degrees,
Oh, yeah.
all the way back. And so you're leaving, going back to Fort Lauderdale, but you're on a whole program.
I am.
And part of the program, besides surgery and rehabilitation, the third part is using medications to attempt to keep the scar tissue coming back.
Yes.
And so you saw a rheumatologist that works with our center.
Yes.
And how did that go with Dr. Fritz?
Dr. Fritz is a very knowledgeable rheumatologist. No nonsense, serious, but absolutely knowledgeable. And the combination of physical therapy, surgery, and the rheumatologist,
And the
the
medication.
medications have really worked.
Yeah, and importantly for me, it's kept down the post-operative swelling.
Oh,
As
yeah.
I look at your knee, can we just peek underneath this
Oh
for
yeah,
a minute?
absolutely.
So we are very fortunate. If we look at this and all the surgery, she really has minimal swelling. And your scar tissue was like we see so frequently. We used a smaller incision. Your scar tissue was all bound down here, all bound down here, all the way to the top. And then we had to lengthen these tissues to get that kneecap working again. So you were very good, and we're very pleased.
You were very good.
Okay. And let's bring in Chad. Chad's worked very hard with
Yes.
you.
Yes.
And so you and Chad have formed a very close bond, like we have to. And Chad, we're going to ask Chad, what do you think, Chad, were the more difficult parts as you worked with her? You did a wonderful job working with her. What do you think were the more difficult issues?
Yeah, I think the most challenging part is the educational component of it. They've had therapy done in a completely different manner for so long, and I think teaching that component of how to address range of motion in the proper way is probably the most challenging thing.
And the best way is gentle.
Gentle, absolutely.
And you experienced some pain with therapy. Push it harder, push it harder.
Right. In my previous experience, I was asked to push beyond the pain, and then I would just get
worse.
I would get worse, and then the range of motion would actually decrease. Instead, here you get a more gentle approach, And
We don't want you pushing into pain.
exactly, and I've
So-
gotten better results.
And we talk about it like a rubber band. You're just gradually stretching it out. And if you can keep stretching it out gently, then you can continue one day after another. Or if you did it all of a sudden, it would be painful and you would lose it. So
Yeah, no, and with the guidance of Chad and Dr. Noyes and the whole team, it's been a wonderful experience, really
Okay.
life-changing.
well, thank you.
Yes,
And
I'm thrilled.
You get a lot of credit because it's hard for a patient. And just as a final note, we used to do this with the patient coming and going, and we just found out we can't do the whole program.
Exactly.
And so you have to commit to be here with us for 4 weeks
Yes, it's
to
key.
do it.
It's key because when you go home, you lose a lot. Life gets in the way, things at home. All of a sudden, it's the middle of the day and you haven't done your exercises because
Got it.
life just happens. But here, you get to focus and you have the team, the support, and here are the results.
Yeah. Thank you.
Thank you.